Aged care advocates say they can't wait on a royal commission, with action needed now to improve conditions for senior Australians. A Central Queensland woman has shared her story of neglect in light of the Four Corners investigation, and her call for better staffing is backed by those who provide the care.
Janice Key's husband Peter needs around-the-clock care. He has severe Alzheimer's disease, and when she needed a break earlier this year, she sent him to a Rockhampton nursing home.
The most horrible experience I think he has ever had.
She would visit to find him alone and crying, and he missed meals and wasn't showered because staff were too busy and they expected him to ask for help.
You've got to actually prompt him in everything that he does or the like. If I say, "Do you want to go to the toilet now, Peter?" and he'll go, "Yes."
But it was what happened to other residents that left her shaken.
One lady's grandma, who is still in this place, they went to visit her and she had ants in her pants.
The ABC has confirmed the incident, but the family doesn't want to go public. In a statement, the company that runs the home says it's required to meet high accreditation standards through the Australian Aged Care Quality Agency and recently received full accreditation. In Queensland, there are more than 400 private aged care homes and 16 state-run facilities. The Premier promised to legislate staff-to-patient ratios in the state homes last year, but there's no law mandating staff levels in private homes. Advocates say that would dramatically improve care and should happen immediately.
Such standards exist in childcare, but they don't exist in aged care. And for us, that's just outrageous. It's absolutely fundamental to the provision of safe, quality nursing to elderly Australians.
Why is it so hard to apply those standards to our most vulnerable in our community in aged care homes? And Mr Speaker, I think this is a debate we need to have nationally. It's a debate we need to have at a state level.
But a peak lobby group says it's not as simple as staff ratios.
Because if we want to attract the very best people into aged care, and they have to be people with empathy, we have to be prepared to pay them what they can earn somewhere else.
Janice Keys just hopes her own health holds out so she can continue to care for her husband at home. Rachel McGee, ABC News, Rockhampton.